March is Colorectal Cancer Awareness Month. According to the National Institutes of Health, over 100,000 people were diagnosed with the disease in 2023. Those numbers, they're big, they're overwhelming, hard to kind of wrap your head around, but they stand for people right here in our small part of the world. WFMY News 2's Sydney Moore has the story of a Greensboro man whose message to others is to always listen to your body.
Tennis.
That's how I like to get my exercise.
A game of focus, endurance, and friendly competition.
And you said you learned from your dad.
I did, sure. Yep, he took us out really early, my brother and me, and we would play a lot.
40-year-old Rob Campbell has been playing the sport all his life.
Played all through college and played in USTA League.
He enjoys playing at Pine Top Sport Club in Greensboro, but his game slowed down after he experienced symptoms of colon cancer in January of 2023.
I started feeling a little tight and full and not having normal bowel movements. And in the course of 3 or 4 days, I went from that to not being able to eat anything else without throwing it up.
So we went to the hospital to get screened.
And they told me then that it was probably cancerous, but they needed to do surgery immediately.
With no family history,
They said that I also had spots on my liver, so that was stage 4 colon cancer.
Campbell was shocked by the words coming out of his oncologist's mouth, especially because of his age.
Usually the major age group where colon cancer involves male or females between the ages of 50 to 70. But with that being said, we do have patients in our clinic who are much older than that stated age, and even some who are much younger.
DeQuincy Lewis with Cone Health Cancer Center at Asheboro says it is recommended that people get screened for colon cancer at age 45. But if you're younger and start feeling symptoms like diarrhea or rectal bleeding,
First thing you should say is, hey, I need to get this evaluated so I can figure out what is going on.
after Campbell was diagnosed with stage 4 cancer, he went into surgery and chemotherapy.
They removed a section of the colon that had a large tumor in it that was blocking the colon. And then in June, the liver surgery.
The surgery kept him off the tennis court for weeks.
So I didn't have the core strength to, support swinging a racket.
He missed out on playing the game he loves.
It was shocking. The tennis community is pretty small, like in any kind of group, and so it spread pretty quickly, and everybody was, I think, devastated by the news.
Pine Top tennis director David Leatherwood plays with Campbell often and supported him throughout his diagnosis. Now, a year later, a miracle. No sign of cancer. Campbell is back swinging his racket frequently.
His personality's as big as his game.
What message would you give to folks who might have just found out about their diagnosis? They're around your age, maybe could be older. What advice would you give to them?
Don't be discouraged. There are constantly treatments evolving, new chemotherapies, new drugs that can help.
He also says to always listen to your body. In Guilford County, Sydney Moore, WFMY News 2.
So we just heard one man's really amazing journey of going from shock to survivor of colon cancer at the very young age of 40 years old. So what we want to do is we want to talk about colon cancer and awareness. So with us today is Cone Health gastroenterologist Dr. Gabriel Manzarati. And so let's talk about this. Let's start with the whole thing about age, because we just heard that someone was 40 years old. We're hearing more and more people who are younger are being diagnosed with colon cancer.
Yeah, certainly it's quite an issue that we're dealing with these days. It's actually a reason why in the last few years the guidelines actually dropped the age from 50 to 45. I think that because we do more colonoscopies these days, because patients are starting to think more about their symptoms, we're able to actually diagnose cancers a little bit earlier. But risk factors like obesity, diabetes, are certainly risk factors that increase the risk several-fold for colon cancer. Patients who are Black, African American, are at an increased risk of colorectal cancer incidence and death from it, and early colon cancer. So previously we used to do them at age 45. Now everyone begins at age 45.
Okay, so you talked just a little bit about some people come in because they have signs or symptoms. What kinds of signs or symptoms are we talking about?
I think the most common symptom that I see is rectal bleeding. So be it red blood, maroon, purple blood, or black tarry stools. That is not a normal sign. Many times hemorrhoids are thought to be the reason. Patients just kind of let that be. But the longer we wait, sometimes we'll actually end up finding that patients become anemic, they get shortness of breath, fatigue, and over time that iron deficiency really can impact a person's daily activities, and that may be the inciting factor that tells them they want to go and talk with someone else or with their healthcare provider. Changes in bowel habits, diarrhea, constipation when you're pretty regular normally are other signs that we think of as changes that could be concerning for colon cancer development.
And you said, to talk about it, which, this is one of those things where a lot of people don't want to talk about their bathroom habits. They feel really uncomfortable about that. So what would you say to folks who are just like, yeah, I've noticed some things, but I really don't want to talk about it with anybody and I don't know who to talk about it with?
Yeah, I think when patients get to our office already, they've already probably felt some sense of being scared, or they had someone that they've talked with to tell them this is not normal. For me as a provider, any patient who comes in, any sign or symptom is not too abnormal, not too weird to talk about. The sooner I know about a symptom, the sooner I can work on trying to resolve their issue.
When you say, we want people to be screened at 45, let's talk about what is screening.
Right. So there are different modalities of screening. Colonoscopy, as well as stool-based testing, are different forms of colon cancer screening. Colonoscopy for most gastroenterologists is felt to be the gold standard because not only can we screen for a cancer that may already be present, biopsy, tattoo, and get them ready for potentially meeting surgeons or oncologists, we can also be preventative. If we find a polyp that is precancerous, we have the opportunity to remove it before it may ever become a colon cancer. So for most of us, colonoscopy is the gold standard, but Cologuard and fit-based DNA testing as stool-based testing also have roles in our armamentarium.
Okay, and a colonoscopy, it's outpatient. You arrive at one time and you're going to leave like a couple hours later.
Right, so for like tomorrow, my patients who are going to start at 8 a.m. with me, they'll come in at 7, so 1 hour before the procedure. They'll meet my endoscopy nurses. They'll get their IV placed. They'll meet our anesthesia team. They'll come into the room, meet me, and I'll talk with them about the risk benefits, because many times I'm meeting the patient for the very first time. Unless I saw them in clinic. We'll go over the procedure. We'll do the procedure, which takes about 20 to 30 minutes. They'll go to recovery. I'll come and talk with them about what we found, saw, and did with their family member or caretaker, give them a picture report, and then based on the pathology that may be pending, or if they had a normal colonoscopy in our average risk, they'll be good for 10 years. If they have polyps or other pathology, that may mean they may have to come back sooner.
Let's talk a little bit about that prep for the colonoscopy. It is that dreaded night before prep that people talk about. So let's just get it out in the open. What is it?
Yeah, so most of the preparations that we use are Miralax form pegylated glycol. But there are some tablet-based forms that still require a good amount of liquid to be taken. But many times it is the difficult part for patients. And so what I usually tell patients, if I see them in clinic or that my nurses will in the pre-visits, will be to mix it early in the afternoon, put it in the refrigerator, let it chill for a few hours. It's usually a little bit more palatable when they drink it cold. Once it's time for them to start, if they use a straw, you'll activate a little bit less of your taste buds once it's going down, and you'll actually drink it a little bit faster. If patients deal with nausea regularly or start developing nausea during the drinking of the preparation, slow down, stop, it's okay. Give yourself 5, 10, 15 minutes and then go back, because you don't want to retch that up, during the drinking part, because otherwise you may have to restart and everything like that. So doing some of those things can be quite helpful for the preparation.
And you can mix it with like some kinds of like Gatorade or lemonade or whatever?
If we end up using like a Miralax-based preparation, which we do sometimes, we'll be able to let patients go ahead and use Powerade, Gatorade, or of their choice, as long as it's not red or purple. But that can sometimes help for patients if they've had either their prior colonoscopies that they didn't tolerate the prep. Maybe a Miralax-based prep will be helpful.
Gotcha. Okay. So people who've never done this before, let's explain just how quickly it should work. So you're supposed to drink all this stuff the night before. Is it something where you need to clear your calendar and be home as you start drinking it?
Yeah, so we do split-based dosing, so half of the preparation will be taken the night before, half the morning of the procedure. We usually begin around 5 or 6 for most individuals. So most of the time, within 1 to 3 hours, you're starting to move your bowels. And so it is important to kind of have that evening off, because you will need to be near a restroom.
Okay, and let's also talk about the procedure itself. We talked about the leading up and how you were going to talk to them and stuff like that, but it's about, what, 20 minutes?
Yes, so usually about 20 to 30 minutes for us to do the entirety of the procedure. The cleaner your preparation, the easier it is for us to do our job so that we can decrease the risks of the procedure and help minimize missing lesions as well. And it just depending on what we end up finding, if we find multiple polyps, that may extend the amount of time that the procedure lasts. But the recovery is about 30 to 40 minutes.
Okay, and then you get to go home.
You get to go
And then
home.
you get to eat.
Yes, we usually tell patients a lighter meal initially just because they've had anesthesia.
Right.
Someone will need to take them home because they will have received anesthesia for the procedure, but just take it easy the rest of the day, and then by the next day you're back to your normal activities.
Okay, we've got about a minute or so. What would you tell people who are kind of putting off the colonoscopy because they're nervous about it?
Yeah, I think that prevention is the key to colon cancer. The earlier that we have an opportunity to find a lesion, if it's present, the more chance that we may be able to have it removed endoscopically. And so if we are concerned at any time of having not necessarily wanting to do a colonoscopy because of the risks, obviously we're happy to meet those patients in clinic, but any screening is better than no screening, and at LeBauer GI we'll be very happy to work with you on your health journey.
Real quick, what are some colon healthy diet items?
Yeah, certainly. So patients who eat high fiber diets, between 20 to 30 grams of high fiber, can be quite helpful. It's actually protective against colon cancer. Eating between 4 and 6 amounts of fruits or vegetables per day can be helpful, and minimizing the amount of red meat per week to less than 5 portions a week has been shown to have less risk for the development of colon cancer.
I know how lucky I am.
When caught early, the colon cancer survival rate is at least 90%. That's why doctors stress the importance of preventative screening starting at 45 to find and remove abnormal tissue known as polyps.
Things like breast cancer, and in this case colon cancer, are actually preventable because we can do a test before it progresses to a cancer and be on top of the game.
Colonoscopies are the gold standard, but at-home screenings like Cologuard and FIT tests are also options.
Deep breath here.
That's how I first learned of my case. My at-home test came back abnormal. A colonoscopy, surgery, and biopsy confirmed I had stage 3A colon cancer. Since the disease spread to some lymph nodes, I went through 4 rounds of chemo. I shared my journey to inspire you to get tested.
There's a saying, don't waste your cancer. And that really struck a chord with me. If I can encourage more people to get screened, and those screenings save lives, that's me not wasting my cancer.
My message isn't falling on deaf ears.
People are coming in saying, Doc, I was reluctant to have my colonoscopy, but I'm going to have it done now because I don't want the same thing to happen to me. I saw Julie Lux's story, she's been through it, and I don't want that to happen to me.
Countless people have also reached out to me. Kevin posted, your announcement finally gave me the push to make that call for my colonoscopy. Debbie wrote, I've put it off for a while. Thanks for the wake-up call.
And of course, Julie's with us. We couldn't talk about this without you.
Right. Unfortunately, it's a little bit too near to me, too close, because it was 2 years ago I was diagnosed. It was this time 2 years ago that I was undergoing my cancer treatments, and I'm so fortunate to be able to talk about my mission during remission. And it was just actually over the weekend I got a letter from somebody in Maryland who saw my story and said thank you so much for sharing it. I've received letters and emails from people really all over the country, in Hawaii, saying that thank you for helping me not feel so alone, because as you know, the cancer journey can feel very isolating, and it can feel like you are battling by yourself, but when you have this tremendous amount of support, you really do feel like, you know what, you can get through it because everyone is lifting you up.
You've definitely championed this and championed the whole check your colon thing. She even has a hat that says check your colon. It made me think about how a lot of people think, well, I don't have family history and I eat healthy and I am healthy because I run. And I thought to myself, well, Julie did all those things.
I'm the poster child of this could not happen to me.
Yeah.
Right? I have been very vocal about I did not want to get a colonoscopy. I was kicking and screaming. My husband said, it is time for you to do this. And I said, why do I need to do it? I have no family history. I have no signs or symptoms. I exercise. I do everything that I'm supposed to do. And little did I know now that it's when you don't have any symptoms. It's when you don't have any family history. This is when you do want to catch it. Because it's similar, maybe an analogy would be kind of like a mole, right? When you go see a skin doctor and you have a mole, you would say, hey doctor, take a look. Does it look any different? Colon cancer is a little bit like a mole inside of you, right? A polyp, it forms, and this is the reason why gastroenterologists go in there during colonoscopy, is to remove those, because the polyp can turn cancerous. And it can take many, many years for it to develop. I'm not talking like I'm a doctor here, but unfortunately when you go through it, you do learn a lot of information. And so this is the reason why you want to get screened early, because you want to be able to catch those polyps before they turn precancerous or cancerous. Did I get it right, doctor?
Right, absolutely. The earlier we have an opportunity to intervene on a polyp, the easier it is for patients. If polyps grow over time, they develop more mutations, become more invasive, we become less and less able to endoscopically remove them, and then, you know, chemotherapy, surgery, or things of that sort will be required.
And also the statistic with early detection and finding the cancer early, the survival rate is more than 90%. So this is something that it is preventable. And it's something that really is something easy to do. And if you saw my piece there, again, I was reluctant to get that colonoscopy. I convinced my general practitioner to give me a fit test. He says, take the fit test. Fit test is one of those at-home screening things. Take this fit test. If it comes back negative, you won't have to get a colonoscopy for a few years. I said, sign me up. Awesome. So I took this test and then it came back abnormal. And I thought to myself, oh no. Okay, let's go see the GI and the gastroenterologist after the colonoscopy. It turned out I did have cancer, and then after resection surgery, it turns out I had stage 3A cancer. So, but here I am today, 2 years later.
Yes, not only talking about it, but we have video of her ringing the bell, because she got to ring the bell, and we were all very excited about that. That video does not get old to me in any way, shape, or form. We are so happy that you are here talking about it.
Thank you.
Hey, at home, if you missed any of this, we're going to post this in the To Your Wellbeing section, because we want to save your life and the life of your family member.